The use of ultra-low dose immunotherapy in cancer. Some interesting research from India. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years and in clinical practice for 27 years. There was a paper published in the beginning of this year, 2026, from India, where they were using what they titled ultra-low dose immunotherapy, in particular nivolumab or Optivo. They basically were using like greater than 1/10 the dose. I think it was close to 1/12 the dose. And this was like 500 patients were randomized, so half of them received this low dose, ultra low dose immunotherapy, and the other group received a chemotherapy. Most of them were head and neck cancers and some lung cancer. And basically what it showed was that there was a survival advantage in the group getting the low dose immunotherapy compared to the chemo. And that the authors were saying, the toxicities were less, quality of life was better. And so this is one of I think the first like randomized trials like this. Now this concept isn't new. There was actually a doctor from Austria, Vienna. His name was Dr. Ralph Kleef, who's now passed away, who I knew quite well. And he was, I think, one of the first who was pioneering this low-dose immunotherapy in his practice. He was open-minded, used, like, say, intravenous vitamin C and hyperthermia, and he just felt keeping costs down and low. He's already doing immune system approaches. Maybe we don't need the same big hammer. And they published some finding as well. So anyways, it's great to see this movement. Again, if this continues to hold true, costs will be less, side effects could be better, because these immunotherapy medications, these checkpoint inhibitors, they could have some side effects. So yes, the thyroid goes, this autoimmune condition, the bowels, but more concerning the lungs, pneumonitis, the liver, hepatitis, and there's a bunch of others that could be more serious. So more information to come. Great to see this research out of India, and looking at a phase 3 trial. So I think this is definitely the doorway where these classes of medications will probably show similar efficacy, most likely, and lower side effects and lower costs.